Well, there is a brand new study just out this morning in the Canadian Medical Association Journal suggesting Canadian obesity rates increased nearly twice as fast during the pandemic than in the previous 11 years. The study found that almost 1/3 of Canadians were classified as obese in 2023. That's an increase of about 8% since 2009. The greatest increase was noticed in women and young children. While the study didn't explore the reasons behind this, Laura Anderson, the lead author of the study, suggested it might be because of the increased stress and burden of care that fall on women during the pandemic. Well, for a little bit more on this and to dig into what this all means, I'm joined now by Dr. Christopher Labos. He is an epidemiologist and cardiologist, and he's joining us from Montreal. Good morning. Thank you so much for chatting with us.
Good morning. Good morning.
Let's start off, first of all, with this study. This is obviously, it has knock-on ramifications when you're talking about people carrying excess weight. What sort of stood out to you the most?
Well, I think we've known for a while that we've been seeing an increasing rate of obesity in this country, as most countries in the developed world have been seeing. I think it was striking that there was a significant uptick during the pandemic. Perhaps not surprising when you consider everything that happened, the lockdowns. A lot of people weren't able to exercise. A lot of people were at home more, perhaps eating more junk food, a lot of stress that went along with it, worsening mental health for a lot of people. And of course, the impacts of COVID that made a lot of people sick and prevented them from exercising. So a lot of stuff happened, but it is striking the degree to which this had an impact and how much it worsened not just the acute health of people, but also the chronic health of people, because the reason why we're talking about rising rates of obesity and why it's problematic is because it sets people up for a lot of long-term health problems like high blood pressure, diabetes, higher cholesterol, and of course, increased risks of heart attack and stroke and increased risk of cancer. So a lot of chronic conditions that are very, very problematic.
Okay, so tell me a little bit about what role does the index, BMI, body mass index, play in determining who is actually considered obese? And, this is a big number. The study found that almost 1/3 of Canadians were classified as obese in 2023. So is that number slightly to be taken with a grain of salt, or is this a number that we should be looking at, solidly and a bit concerned here?
Well, I think we do need to be a little bit concerned because the number is going up. It's sort of like political polls, right? The actual number in a poll is less important than the trend. So if you're doing, regular surveys, which is what's going on, and you see that number keep going up, even if you do want to sort of say that BMI can be inaccurate in certain circumstances, which it can be, the fact that it's increasing does suggest that we are putting on more weight. I mean, we're not getting shorter, we're not bulking up with muscle in this country. When you see BMI increasing, that's largely because we are putting on more adipose tissue, more fat. And so, absolutely true. There are circumstances where BMI is not accurate, pregnant women, right? Men with a lot of muscle mass and all that. But by and large, it is reasonably accurate in most circumstances for most people. And the body mass index was initially designed for exactly studies like this, so you can assess and track populations. So whatever limitations it has as a measurement for you as an individual, it is still pretty good as a research tool when you're assessing entire populations.
So obviously not good that we're seeing Canadians their body masses going up. We know that there's a lot of health issues there. The fact that we're looking at women and children in this group, does that add an extra health burden?
Well, it does, especially with children. I mean, obviously, you don't want to see anybody gaining weight, but especially the increasing rates of childhood obesity are very problematic because you're just increasing the amount of time when you're carrying that extra weight, and that's setting you up for more health problems. Now, if you've packed on a few extra pounds and you're in your 60s and 70s, I don't want to say that that's normal. That's to a large degree expected. But when you have increasing rates of childhood obesity, you start seeing more diabetes in young people, and not just type 1 diabetes, but type 2 diabetes, which would have been unthinkable 20 to 30 years ago. So you're seeing more diabetes in young people, more arthritis in young people because they're putting more weight on their joints. And we are going to see more chronic health problems because we're just subjecting these kids to risk factors much earlier in life, as opposed to, things that they would have dealt with when they were in their 50s and 60s. Now they're dealing with them as teenagers, and that's not going to be good for a healthcare system that is already struggling to deal with a lot of the chronic diseases that we deal with in this country.
What about weight loss drugs like Ozempic? What role do they play in treatment right now, and how effective are they?
Well, they are very effective, and that's why we sort of keep talking about them. They haven't been in use for long enough or been widespread enough to have affected the numbers in this particular study. I think it's going to be interesting to see 5 years from now what happens. Do obesity numbers start to tick down? The big problem with Ozempic is access. It is very expensive. It's often not covered by insurance, but I've had a few patients who were able to pay for it out of pocket, and they lost a considerable amount of weight. You know, when you're 250 pounds and you can drop 30 to 40 pounds or get close to 200, you know, some people might say, is like, well, you know, you're still carrying a lot of excess weight. That's true. But being able to lose 30, 40, 50 pounds, that makes a huge difference to your health and to your well-being. And I think that's the important point when we're talking about these obesity medications. It's not about aesthetics. It's not getting back to the same weight that you were in high school. It's about improving your health and preventing disease. And that amount of weight loss can be very, very useful for that.
And as you said, you know, being able to reduce that weight, give them more opportunity to improve their health, improve their activities, all those other things that they need to, you know, keep those sort of very serious health issues at bay. There is talk of course, you mentioned it, it's incredibly expensive. However, there's potential here because Ozempic's patent in Canada set to expire coming up. So what does that mean for the potential of this drug?
Well, we'll see. For, you know, in a series of very bizarre events, it looks as if Novo Nordisk was not paying the maintenance fee of their patent, which they allowed to lapse. Really unclear why they did that. But it does mean that come January, it is very possible that another manufacturer might be able to produce Ozempic and sell it in Canada. Now, we'll see if that actually happens. There are a lot of issues with patent laws. Companies can sue each other. They can challenge each other in court. There are things called evergreening, where companies will modify the drug a little bit to try to extend their patents. There's something called pay for delay, where a company will pay another company not to actually bring a generic into the market. So we'll see if it actually does happen. But the potential to have multiple producers producing the same medication has the potential to reduce the price. We will see with Ozempic, because it is more complicated to make than just a standard blood pressure or cholesterol pill, right? It's a biologic, it's an antibody. So that's going to make it a little bit more challenging. So the price may not drop to, you know, pennies a dose, but it might come down, and that would help make it a little bit more accessible for the people who actually need it.
Always great to get your insights. Thank you so much. Dr. Labos is an epidemiologist and cardiologist. Thank you.
Take care.